Good day, I'm Alexandra Loren, caregiving student from St. Augustine, and I will be showing to you how to perform the perineal care. Perineal care involves the washing of the genital and rectal areas of the body. It is to prevent the irritation, odors, and infections. So now let's prepare the necessary equipment such as bedpan, assuming that this basin is a bedpan, pitcher with warm water, two forceps, draw sheets, kidney basin, the clean gloves, perineal pad, seven dry cotton balls, and also the seven cotton balls soaked on the antiseptic solution. This helps to save time and energy. Do not forget to perform hand washing to prevent the spread of microorganisms. After preparing the necessary equipment, let's explain the procedure and treatment to the client. How she can participate, provide the client opportunity to ask her concerns, and of course establish good rapport to the client so she won't feel uncomfortable during the procedure.
Ensure the client's comfort and privacy. Explain the procedure and the treatment to the client, how she can participate.
Hello, ma'am. I'm Alex, your attending caregiver for today. May I know your name, ma'am?
I'm Mary,
When is your birthday?
July 23, 1987.
Is it okay if I go check your wrist, ma'am?
Okay.
What do you want me to call you?
Just call me Mary.
Okay, Mary. The one that I am going to perform to you is the perineal care. It is to remove the normal perineal secretion and, of course, to prevent infection and contamination. So, I will be touching the parts of your body, especially your genitals. Is it okay with you?
Yeah, sure.
Okay. Do you have any clarification or concerns?
None.
As you can see, I closed the curtains so that nobody can see you and respect your privacy. Okay.
Cover her body and legs with a bed blanket. Position the patient on the dorsal recumbent position with her knees flexed and then put the patient into the bedpan. It is to prevent the bed becoming soiled. In putting the bedpan, if the client cannot lift their lower body, we can help them to turn. Fold the door sheets to roll them carefully. Put the bedpan on the bed and make sure it is centered well. Assist your client to roll back. Raise the head of the bed so they are sitting comfortably. Now that the client is in the dorsal position, make sure that you expose only the area to be cleansed. It is to minimize the exposure, to avoid client to be embarrassed, also for the privacy of the client, and of course, to provide warmth.
So now I'm going to flush the perineal area with warm water. As we're doing this, let's also inspect the perineum. Note, for the particular inflammation, sweating and vaginal discharge, our secretion and presence of odors. Warm water is used to prevent chilling and to dissolve blood clots. Get a cotton ball soaked in a cleansing solution using a pickup forceps. to maintain sterility. Cleanse the external genitalia starting on the midline, mons pubis down to the anus. Then discard. Don't forget to never retrace a stroke to prevent the contamination of the area with a second cotton ball starting to the mons pubis in a figure of 7 by the way of external labium towards the anus. Then discard. Secretions. They tend to collect around labia minora, facilitates bacterial growth. Do likewise in the opposite side by the next cotton ball. So now, with the fourth cotton ball, starting with the mons pubis in figure of 7 by way of external labium towards the anus, then discard. Do likewise on the opposite side with the next cotton ball. Another cotton ball, clean groin, starting from the groin, going to the thigh. Use other side of the same cotton ball for the near groin. Then do likewise. Discard. Now let's flush the perineum truly with warm water. Using the 7 dry cotton ball, dry the perineum just the same stroke that we did earlier. Moisture supports many microorganisms. Now, let's remove the bedpan gently and turn the patient to the side. Now let's put pad with up and down motion as needed to prevent contamination of the vagina. So now, let's record the treatment that done with the patient and also the discharges observed for the documentation purposes.